Thank you, Caroline. That was excellent. And last but not least, I'd like to introduce our fourth speaker, Dr. Rachel Nugent, who's Vice President for Global Non-Communicable Diseases at RTI International. Dr. Nugent was a member of the planning committee for this workshop, and she will be speaking on the double burden.
Thanks, Chris, and thanks very much to the Roundtable for inviting me here. I am delighted to talk about the double burden of malnutrition. I think it is really an important thing to bring into this discussion about global obesity, even though it has some particularities, which I will raise, and then I hope we have some discussion about what we can learn from all of these presentations. I can't resist, I should resist, but I can't resist a small confession. When the planning committee began our discussions and we first started thinking about names of people for this panel, I got way ahead of myself and I said, oh gosh, we can't have a manel. And as you see, we have a WANL instead, which is actually very gratifying, and particularly gratifying to see for those of you maybe who are watching from other countries that a MANL is a man-only panel, which we don't favor, and a WANL is a woman-only panel. I won't comment on whether or not we favor it, but what I'm very pleased to see is that we have a very nice average age of the presenters here. Let me put it that way, which shows just the fantastic research that's being done by new and emerging researchers, and that bodes well for the field. So thank you, folks. And that's the end of my confession. Now I'm going to figure out if I can work this system here. Yeah, I guess I can. All right. Again, a very we could spend days talking about the double burden, but we're not. They gave me 20 minutes, and I'll try to stick to that. But I'll do a quick what, where, and why, and then talk about drivers and reasons for the double burden. Again, there's a lot, and we'll touch on just a few of them. I'm going to talk a little bit about the economic costs of the double burden of malnutrition, because that's something I've been working on a lot in the last couple of years. And as an economist, I can't resist getting in some economics. And then what are some of the responses that we think are appropriate? And I stress that we think are appropriate because we actually haven't tested much of anything. And then some of the challenges, particularly in doing research in this area. I will acknowledge right off the bat that a lot of these, well, some of these ideas and some of the data come from both myself and colleagues that are working on a Lancet series on the double burden of malnutrition that'll come out next year. It's still in progress. Certainly not going to be revealing anything that is underway, but I think it's important to point to some of the issues that we have been exploring in the development of this series. And of course, my role in that series is to look at the economic aspects. So again, that's why I brought it in, plus they asked me to. So the what of the double burden of malnutrition. Some people call it dual burden. I don't, as you'll see with a few of these points that I'm going to be making, we don't have sort of something definitive on this. It's perhaps a new enough issue or a poorly researched enough issue that there are a number of important aspects of it that are not fully pinned down. So you call it double burden, call it dual burden, doesn't matter to me. But essentially it's the coexistence, the simultaneous presence of undernutrition, and that can be measured in a number of ways, as you know, including for this purpose, as well as overweight and obesity at the household level. Now, somehow late last night, I was going through the slides again and made some fixes to the slides and then didn't save those. So most of those don't matter much. It's like, you know, a little tiny thing in the reference. But here it does matter because it's not measured only at the household level. It can be measured, of course, at the individual level and at the national level or regional level. So I was omitted putting that in there until my last unsaved version. So simultaneous existence, stunting, wasting, and micronutrient deficiencies, 3 measures of deficiency or undernutrition. I'll show you some data that include 2 of those 3 measures and then 3 of those 3 measures, and then overweight and obesity. We focused so far here quite a bit on obesity, but we are including in this definition overweight. Number of people affected, roughly in the neighborhood of 800 million people in the world affected by undernutrition. Various measures, and this comes from FAO. It's recently gone up a little bit after many years of going down. This is all pretty much estimated in some places. And then a much larger number of people affected by overweight and obesity, likely to be over 2 billion now in the world. You saw a somewhat lower number earlier from Lindsay, which was obesity, not the combination of overweight and obesity, just to be sure. Now, an important thing to mention here, I think that is helping to motivate the research, the Lancet series and other research, is that as of 2014, when there was the big Second International Congress on Nutrition in Rome, it was framed as malnutrition in all its forms, not double burden, but the problem of nutrition, if you will, around the world, or the issue of nutrition, malnutrition around the world, was framed not as we have undernutrition or we have obesity and overnutrition, but in fact there's malnutrition in all its forms, and that's what we want to understand better. And I will suggest in a few minutes some important reasons why, and that is now the framing that is very much put forth by WHO and FAO, and I think getting to be more accepted. Critically, and I'll sort of just forecast, critically that's because of these relationships that we don't fully understand yet, cross-generationally, cross-geographically, across life cycle of the relationships between under and I don't use the term overnutrition, but overweight and obesity. So we'll look a little bit at that here momentarily. The where. This, I have to thank Barry Popkin, who really is, I won't even say one of, but I think probably the grandfather of this kind of work, stemming from his very early work, pre-2000s, on nutrition transition. And he provided this slide for me. I'm not the person who has dug into the data. He has many, many reams of pages of data on this, where he's gathered data from a number of different sources, UNICEF, FAO, and other sources, to try to give us a good sense of where the double burden is occurring. So he's got 2, so thanks Barry, if you're watching. He's got 2 maps here on the left-hand side. This is using 2 measures, one of undernutrition, wasted or stunted or thin, and then a measure of overweight and obesity in child, adolescent, or adult in the same household. So that's on the left-hand side. And you'll see that if you measure, and the variation here is in the prevalence of obesity and overweight. So those colored shades there reflect the level of prevalence of obesity and overweight across countries. So if you start with, say, a cutoff very high of 40% overweight and obesity, that's the darkest color here. There's just a few countries where you'll find that high a level of obesity and overweight alongside a high level, and you might not be able to read the fine print there, but a level of underweight, 15% with wasting, 30% or more with stunting, 35% or more with wasting and stunting. So quite high level of undernutrition with a very high level of overweight obesity. That's the dark red. And you see only a few countries. And then if you say, okay, well, let's expand that overweight obesity group, bring down that threshold to 30%, you add countries that are that middle color orange there. And then if you expand a little bit more to more than 20% overweight and obesity, which is still a pretty high number, as we've been seeing. And I think important, that's why he's showing us this, important to reflect that in some countries, where you have 20% overweight and obesity simultaneously with high numbers of undernutrition, you have a very significant double burden problem. So that's basically the point there, is that, you know, depending on the definition, and I think underscores that we don't really have firm agreed definitions, not just for the name, but for the cutoff points. Depending on the definition, there are a lot of countries affected or fewer. Now, it's important, and I looked at these graphs that I'll mention, the right-hand one in a moment, I looked at these maps and said, but wait a minute, what about South Africa? What about Mexico? At sub-national level, if we were looking at that level, we would be finding lots more places, India, Mexico, South Africa, where we have very high prevalence of underweight and overweight and obesity. At the national level, for a number of these countries, one or the other of them washes out. So again, this is sort of very high level. On the right-hand side, what Barry added here was anemia, where you do have a lot of countries with persistently high anemia, especially among women and to some extent among children. So you'll see a slightly larger group of countries there on the right-hand side. And again, it just reflects that we don't have one common definition. So that is sort of the where. There are many other, as I said, many other ways of looking at these data, but I think it gives you a sense of what's going on there. Now, this is the why. This very busy picture here emerged from a workshop that was held a few years back that I was involved in, Barry and Corinna Hawks and others, looking at the reasons or the drivers of cardiovascular disease. And we started out with a fairly narrow focus, and it just grew and grew and grew. So this is what emerged from that. And what it's telling us is that there are, many of these environmental drivers stemming from diet and upstream from the food system and upstream of that from agriculture. And if you look at the changes over time in that whole sort of supply chain, if you will, or that whole continuum of, how people are, what they're consuming, how it's processed and produced, you'll see that there are a lot of warning signs along the way. And if I can use the pointer, look here, so this stage 6 is really not where we are. Stage 5, there are definitely a lot of familiar signs there of what is driving our nutrition conditions in most countries. I've done work on food systems, and there are many ways you can typify food systems and many results that come out of different food systems. So again, this is sort of broad generalizations, but even in lower income countries in the world now, we are seeing, whoops, oh, no wonder. Everybody had trouble controlling this, and me too. We are seeing that countries are, very much at this stage or this stage, and some, of course, are trying very hard to move into the more sort of, can we get what we need out of our food system? Can we get our food system to deliver us what it takes to have a healthier environment, eating environment? And that's a longer discussion, but that's a lot of what's going on with our food. Here's a little picture of it. I think it's very hard to pin down information about what people are eating outside of the data that FAO has been collecting for many years in FAOSTAT, where we've got fruits and vegetables and grains and various staples and so on. It's the processed food that is harder to pin down, and this comes from work that many people have done, including myself, for purposes of the Global Nutrition Report and other work. But Barry has pulled together, again, for the Lancet paper, some numbers from Euromonitor, and there are now are starting to be much more available systems of collecting this at the retail level. It doesn't tell us everything about what people are consuming, but the story is very clear. The axes here are different, so you can see the different amounts of sugar-sweetened beverages and what this was from Barry as well, junk foods, as he calls it, are being consumed, and you can see, a very consistent trend. It varies. It's steeper in the lower income countries than in Chile. Chile, I will add, and we'll get to this in a moment, also has a very aggressive policy approach to dealing with a healthy diet. And we're not yet seeing that in a number of other countries of the world, which we'll talk about more. So that's just a little bit of a picture of one of the important factors behind this. Let me turn quickly to the economics. As you can see, I've digressed from just looking at data, which this session is primarily intended to do, and to hint at some of the reasons and the concerns that arise out of this. The economic literature on double burden is very thin. There have been 2 studies to date. We reviewed for our work, prior to looking at the economic burden of the economic literature on double burden, we reviewed the economic literature on underweight and the economic literature on obesity and overweight. Of course, when you separate them, there's much more literature. For overweight and obesity, it's thinner, and most of it comes from higher income countries. For underweight, most of it comes from lower income countries, not surprisingly. But when you combine it, you have very little to look at. And that is generally the story about looking at double burden in general. The ECLAC study, so the Economic Commission of Latin America and Caribbean, produced this study a couple of years ago. Really the only significant modeling study on economic burden of the double burden of malnutrition. And they looked at multiple pathways to measure the costs of undernutrition and the costs of overweight and obesity, but different measures. And that's one of the key points I want to get across, is that we don't have common measures, not too surprisingly. For undernutrition, these might be familiar, looking at the risk of disease due to undernutrition, looking at educational attainment related to undernutrition, lifetime earnings. These are very standard ways that economists look at the burden of health or disease issues. And overweight and obesity impacts are largely measured through medical expenditure and productivity impacts. So those are 2 different ways of measuring the impacts of these 2 different malnutrition conditions. In that study, the results found, several from very minimal up to several percent of GDP loss from the double burden of malnutrition. And they did it for 3 studies in Latin America. Chile, the whole impact was from obesity, no significant impact from undernutrition in Chile, up to Ecuador, which had the highest impact, 4.3% GDP loss, more from undernutrition than from obesity, but both quite significant. Barry Popkin did some work much earlier on, just looking at China and India, and then updated that work. And just briefly, it wasn't as detailed an economic model, but he used epidemiological data to measure, and again found between 1% in the earlier numbers back in the 90s from India, but updated, showing that the economic cost may be as much as 4% of GDP loss, with projected to keep on going. That's in China. So what do we learn from this? I mean, we have lots to say about the lack of modeling capacity, let alone the lack of empirical data, and I'll say a little bit more about that in my conclusion. But I think we can feel pretty certain that there is a significant economic impact from both of these conditions. That's not a surprise. But looking at the combined conditions, and again, the ECLAC study really measured 2 different things and added them together, which is not a, in my view, a perfect, by far from perfect way of measuring double burden of malnutrition, but it's the best that could be done. Just to speak a little bit about what we can do about this, and I'm sort of anticipating a little more discussion later on in the day about responses. This work was put together by the WCRF, the World Cancer Research Fund, and others, Corinna Hawks and others, who have developed some recommendations about double duty interventions, as they're called. That is, interventions and policies that can address both of these forms of malnutrition, or all, if you will, of these forms of malnutrition. And there is a good deal of evidence for impact on malnutrition. And some of this is shown here. I'm giving you a few sources. I'm not going to go through all of these interventions, but I guess I would say that what we don't have evidence for is impact on the double burden. So we have impact on one or another form of malnutrition, but not on the double burden of malnutrition. Again, that's sort of our big gap here. But there's quite a lot here. These interventions will be familiar, I think, to many of you who work on nutrition in various forms. For our work on the economic costs, we picked a couple of them where we could get very strong data on impact on both undernutrition and overweight and obesity. And by strong data, I mean data that we have confidence in, or results, effect sizes that we have confidence in, but not necessarily large effects. So particularly for breastfeeding, there's not a measured large effect on overweight and obesity. There's literature to show that there is an effect, particularly on the mother, but it's not large as far as we understand now, which could change with better studies. School nutrition, similarly, we certainly can see that it, and in various empirical studies around the world, that it has the right school nutrition programs can have an effect on both undernutrition and overweight and obesity. Again, it hasn't been, rarely been tried together. That is, to affect both of them together. And then food advertising. Both have effects on overweight and obesity. So that's what we've been analyzing from an economic perspective. Just to wrap up on some of the challenges, I've mentioned a few of these as I have gone along. Complex set of drivers and conditions that we're trying to grapple with here. And very uneven and non-comparable data sources on the various forms of malnutrition, with much more information available on undernutrition than overweight and obesity, particularly in developing countries. We have intergenerational impacts here across households, both epigenetic, I'm sure genetic, that I can't even speak to, but clearly epigenetic and environmental, and across the life cycle as well, with the impacts that we can measure, but again, we've only measured them separately. As I said, the domains of undernutrition and overweight and obesity use different outcome measures, so we have to try to reconcile those somehow. And as I have already mentioned, we really don't have evidence from studies that have combined the thinking and the knowledge here to say, you know, what happens when we simultaneously use programs and policies to address undernutrition, overweight, and obesity. What happens there? What is really going to work for both of them? And I think that's a serious gap. There's a lot of literature here. This is just a quick overview, not meant for you to read. And thank you very much.